Okay, so one of the procedures that we are doing today is we are doing strep testing as well as getting a throat culture. So a couple of things. There are parts of your mouth that we do not want to collect or get or touch with the sample swab. What are those parts? Cheek, cheeks, teeth, tongue. There's one more. Okay. Yes. Those two, yes, but there's one really distinct one. Yes, the uvula. So, or the UV. Yeah. Why do we not want to touch those things? Teeth, tongue, cheek, uvula. So they have bacteria, but what kind of bacteria? Yeah, they have normal flora bacteria. So what that means is that they have just this normal good bacteria. And if you were to collect that on your sample, you're going to get a false negative. Okay, we don't want that. We want to be able to get the actual results here. So with that, you want to swab the tonsil area. Now, how many of you or who in here has had their tonsils removed? One. Okay. So everyone else today, except for whoever has Taylor, you'll write your where you got this from the tonsils. If you have Taylor, your swab will come from the throat only.
That's the reason I gave.
Yeah.
That would be
So I'll teach you a little trick, hopefully, to make you not get.
That is not
Good luck.
Well,
I'm a very bad guy.
Oh my God, you stop it.
So
Not like that.
I'm going to have you guys doing these at the phlebotomy station for one reason. A, it's easier to have your patient sit and you stand. You get a better visualization of where we're going. But also, they can't run away from you. What? What'd you say?
You're gonna yell at me. I have my camera in.
Oh, you're fine. Now, it might get in the way of the tongue depressor, but we'll deal with that. So your patient will sit. You want to have your patient sit and tilt their head back. Not all the way, right? Because if you go all the way back, you can't see anything. So back enough that you can get that good visualization. You're going to have them open their mouth as wide as they can. Stick their tongue out as far as they can, and then do what? Say ah. Why are we saying ah?
Open it up.
Yeah, it opens up that tonsil area. Okay. And then your job will be then to take the swab stick and the tongue depressor and hold everything down. So these two items to begin. Sorry, I was showing the camera and you guys. Both of these are sterile. So what that means is until this is opened, it's considered sterile. Now, if you get this in the package, it's ripped or damaged, then we would want you to change that out. Okay. Which hand do you think is going to hold which item? Okay, so you're saying dominant hand is going to hold the swab stick, non-dominant is going to hold the tongue depressor. Yes? Okay, that works for me. However, if your dominant hand is weak, right? Like take my strong hand. If it's not strong,
I was thinking that in my head when you did that.
no.
I did too.
If your hand is not strong as a non-dominant, you want to switch that because you want to have good pressure to hold that tongue down because the tongue's natural reaction is to do what? To push something away or go back and cover what's there, right? So what I like to do is I kind of open these just enough so that I can grab everything out, okay? I do like to use my dominant hand for the swab. That's my choice. I'm very good at this, okay? So tongue depressor, when you do this, just for a minute, I'm going to lift this up so you can see what I'm doing. Okay. When we do this, we are not saying put the tongue depressor here so they stick out their tongue. You're not going to do anything. That tongue is going to just fly away from you. We are saying you take this and it does this.
Oh.
Okay.
I know it's making me just watch.
You have to go into it and hold the whole tongue down. If you don't, you are not going to get a sample. Plain and simple. Okay? The other thing I like to instruct is that you hold the swab stick at the end of the swab stick, and I do it just in between my middle finger. That's not my middle finger. Index finger and thumb. Okay? The reason I don't want you holding here, if I try to go into their throat, my hand is in their mouth. That's not helpful. If you hold at the end, your hand stays out and you can do what you need to do. Okay? So, in, and you're going to do a figure 8 motion. So you're going to do something very similar to this. Not that slow, because somebody will punch you. Okay? Right? It's a good swab in and out. Okay? You should be in 5-10 seconds at the most. We are not painting. We're not getting enough sample to make a paint. We're in, we're out. But that figure 8 motion allows you to avoid the teeth, the tongue, and the uvula. Okay? It's also a good idea as you're doing your figure 8 to rotate the swab in your fingers. Why are you doing that?
Completely covered.
Completely cover that sample. Okay? I'm not actually going to swab my entire mouth or get back because I can't see what I'm doing, so I'm not going to attempt to do this. But you swab, and then what you're going to do is take your sample. Hold on. Don't start with just taking the sample. We're going to start down here. You're going to start by taking one of these disposable extraction tubes. So these little plastic tubes. Little plastic tube. And you're going to put it into one of the numbered holders. So I will tell you a number when you come up. It's 1 through 4. The reason I'm doing that is because you can't put patient names on these. So if I tell you you're number 1, you know that that's yours to come back to. Okay? So you take one of these extraction tubes. You're going to put it in one of the numbered holes, and then you're going to look at using reagents A and B, what I like to call the ketchup and mustard, because they are red and yellow. Okay, very easy, red and yellow. You're going to put 4 drops of reagent A, 4 drops of reagent B. So 4 of ketchup, 4 of mustard into your extraction tube. This sets it up. Once you have that piece of it done, then you can collect your sample. Okay, so you take your sample. After you have collected it, we're going to go into your extraction tube and you're going to swish it around 10 times. Okay? After that 10th time, you're going to stop and leave it for 1 minute. Just in there, just sitting there chilling. All it's doing at that point is it's pulling off all that excess sort of mucus or membrane bacteria, and we're letting it sort of mix with those reagents. After that 1 minute, I want you to pinch. After the 1 minute, you are going to pinch the tubing, the plastic tubing, and you're going to pull your swab stick out between your fingers. Kind of like a little squeegee. It's going to squeegee off everything that got stuck. This can then go into the garbage before you panic and you're like, no, it's biohazard. It's not. Okay? Not biohazard. Just regular trash. And then you're going to put in one of these dipsticks. Okay? The dipstick goes in for 5 minutes. After that 5 minutes, we'll come back and have you read it. Now, what line should appear at all times? The control line. Control line. Now, the control line for this is, and I'm going to pull it out for you guys, and I'll bring these around so you can see them. If you look at these little test strips, there's up here at the top, it says C. Down here at the bottom, it says T. The C is your control line. So that one's going to be more towards the top, and it typically is the darker of the 2 lines. If there's a line below that, that is your test line. So what does that mean? If strep, it's positive result. What if you just have the control line? Negative. What if you just have a test line? Invalid. Can I write that result or give that patient that result? No, we have to make sure that we do have a control line. So you can see this, Tila. You can see that this one here is our negative. You see just the control line. Let's see if I can get that up a little bit better for you. Nope, that's the test one. Just kidding. That's what I get for trying to look at the camera. Just your control line there. And then this one has the 2 lines. That is your control and your positive test result. Okay. So you collect your sample. How many times do we swish it? How many?
10.
I just didn't hear you. Your mask is on. 10? Is that what you said? Okay. After the 10th time, what are you going to do? Leave it for 1 minute. After 1 minute, what are we going to do? Squeegee it out. And then do what? Put the strip in for how long? 5 minutes. Very good. All right, let's do it. Okay, do you guys want to learn how to do a wound culture and collection, or do you want to learn how to do a smear collection? Wound? Did you say womb? Wound. Yeah, no wombs in here. The only womb that we're worried about is Serenity's womb. Okay? And we're not going to visualize that. You keep it to yourself. Okay. So, when you're doing a wound culture, okay, what does that mean? A wound culture.
We are culturing the bacteria inside the wound to
Okay.
see if there's
Okay, so we're culturing the bacteria within the wound. Yes, we're doing it so we can see what kind of bacteria is there, but we're also doing it to make sure that the antibiotic treatment that we do is correct for it. Okay? So, my question is, here's my wound. Here's my wound. I know, right? It's a cute little belly.
I actually have a very graphic picture of a wound.
No,
That's
thank you.
exact same.
So it's a belly. This is a belly button. Belly.
Please don't collapse the belly button.
I will do what I want with my belly button. You cannot stop me.
Alright. Just make sure it's clean.
Yes. So, before we do any sort of culturing or cleaning or anything like that, what do we want to do first? So let's see if you guys remember from Q1.
We want to look at it.
What?
We want to clean the outside.
Yeah.
Okay, before we do any cleaning,
We're looking at
what are we looking for?
it. Redness.
Redness. So we're looking for signs of
Oozing.
infection. So redness, oozing,
Smell.
warm, smell. So, yes. So we're looking for any redness, swelling, oozing, whether that's blood or pus. We're looking for any heat. So, looking at our wound here, do you see anything?
Yes.
Pull that up. So it's red, definitely red around the edges. What else do we notice?
Swelling.
Does look a little swollen, doesn't it? Maybe some internal bleeding. It definitely has some inflammation. I'm going to go ahead and tell you that it is hot to the touch. Is it really? No. But for this demonstration, it is. So do we think that this patient probably has an infection?
Yes.
Absolutely. Now, in order to get a good sample, we would want to clean it until we don't see any sort of drainage removed from it. But before we want to clean it, if there is drainage, we want to get that drainage, right? What would we use? What would we use to collect drainage? What kind of swab? What?
A big one. A culture swab.
Okay, a culture swab. But what makes it a culture swab? Excuse you.
Sterile.
It is sterile. Let me put this in do not disturb. Hold on. Yes, we want a sterile swab. Why a sterile swab? Very good. And not from me.
From a patient.
From El Mundo over here.
El Mundo?
Like I was.
Wow.
Oh, our 5 minutes is done. So
Yes.
let's, real quick, let's check these. So number 3. Negativa. Number 4.
Negativo.
Very good. Everyone was negative today. You all get to stay.
Wonderful.
Ta-da! Okay. Monique laughed at me like, great. So, when I do a wound culture, where am I swabbing?
Around it. Yeah.
Why around the edges?
anything that's leaking?
Okay, so yeah, any drainage that we have coming out, absolutely collect that. But why would I not just take my culture swab and go right in the middle?
Because you could be,
Ow.
you could be infected, put in bacteria like.
Yeah, maybe I'm infecting it more, or I'm tearing that up more, so I'm gonna start bleeding more. So if they have drainage coming out of it, collect the drainage. Now the nice thing about it, if this was a real wound, right, and it was oozing, where's it gonna ooze to? So we would swab the belly button, right? Now, the other thing that I've seen is people who have like wounds on their legs that are what we call weeping. So it's just kind of running down the leg. We would get that is running down the leg. Same thing. Anywhere that it is actively leaking out, we want to try to collect that leakage. Now, this one doesn't seem to be leaking anymore, so we are going to do those edges. And you'll notice, not only am I running along the edge, I'm also rotating my swab. Why am I rotating the swab?
You get it covered.
Yeah, we want to cover that whole swab. And it's both sides, not just one, but both sides of the wound. Why both sides? Very good. So one side might be infected, the other side might not be. We would then send this for a culture after, how long does a culture take to run?
30 minutes?
No.
24 hours.
24 to 48 hours is going to be your culture window. So the provider today might put them on an antibiotic, but they feel will help them. We get the results back in 24 to 48 hours, and we find out that it is resistant to the bacteria resistant to the antibiotic we gave them. What do you think we're going to do? Very good. That makes sense?
Yeah.
Wound cultures sound good? Yeah. Good. On your skills log, get that out. That same section, that lab and CLIA wave section, you have something that says perform a wound culture. You can do that and write the results as WNL. What does WNL mean?
Within normal limits.
Very good, within normal limits. For your results, yes.
What we put our patient on.
Put your patient from today. WNL. Okay. And so for this next one, I will tell you guys, you will want to get up and get close to me so you can actually see what I'm doing.
Just like chilling there. Hey, that's smart. What am I doing?
Okay.
I miss you.
Okay. You can't hover around there because I have to stand there.
I'm saying hi to Tila.
Oh, they're saying hi. Oh, gotcha. Okay.
Yeah, it's important.
You're absolutely right. Okay. So we're going to do a blood smear. So we're going to have our sample. And then we also use this little device here. And what this little device does is it goes on top of your tubing to give you the perfect drop of blood. Okay, can you see?
I was watching on the camera, but I'm
Oh.
going to stand up.
You can watch on the camera, that's fine. So I'm going to puncture that through the top. Maybe. Be stronger than the device. Okay, so now that is in there. And what we're going to do is we're going to make the drop up here at the top on one of the slides, and we're actually going to drag that drop downwards. And what we're doing is we're sort of spreading out that bacteria. So then when we gram stain it, which means that we are going to use purple and red dyes, and whatever is going to stick into the bacteria, whether that's gram negative or gram positive, we'll highlight a different color, and we'll look at that under a microscope. Not today, but because we're not microbiologists, and I can show you, but it's not going to do any good. So you're going to take your sample right up here at the top and get one perfect drop of blood. Boop. Okay. I'm going to give you a job. Hold that. Actually, I lied. Let's get a bigger drop. There we go. Okay. You're going to take a second slide You're going to put it at a 45-degree angle. We're going to go up to our drop, wait for it to go all the way across our slide, our second slide, and then drag it back down. That is how you make a smear. Now, that would be your roll, right? That's where that ends. You would let this dry before you would do any sort of gram staining. And then we would go through that process of gram staining. But you guys don't need to know how to do that. We just needed to show you how to make the smear. Does that make sense? Do you guys have any questions? Okay. So go ahead and document that on your skills log. That will be the last one for today. Yep, you can put results again as WNL. Yep. Make sure that you have done all of the charting on your skills log, and you're going to put that all together back into your chart and put your chart in the black bin for grading. Another reminder, if you have not, or your team has not, for the diversity course project, sent me your top 3 list. Please make sure that you get that to me by the end of the week. Monique, Tila, and Andriana, do you guys have, I need the externship sheet I gave you in week 1. Okay, that's okay. By the end of the week, I want your resume. So externship, pre-externship resume by the end of the week. Same thing for you, Miss Tila. Turn it so you're actually looking at me and not at my. Oh no. So, yep, that's the sheet I need into the black bin. Pre-externship resume by the end of the week so I can start getting that process together for you guys. And then, Andriana, I also, week 1, when we did the syllabus sign-off sheet, I never got yours. So if you have that, I need that as well. Okay. Outside of that, we are done for this week. Next week, we are talking about cardiology. So it would be best to wear a sports bra. If a sports bra is not your thing, just make sure that you wear a bra that does not have a wire. Do you have a sports bra? Okay, I'll have to make that work. It's going to read funny, and that's why I don't want to do that. Because I don't have you take off everything. I try to keep you as covered as I can. But if you, wireless is what I prefer, but if we can't do that, then we'll work around it. I will take those in just a minute. So, all right. Pause the recording here.